When I was, struggling in dental school, failing out over there, like it wasn't even like a a thing that crossed anybody's mind at the time. They're like, you're just being lazy, or you're just being, the laziness is a big thing, right? Because people will say like, you're just being lazy. You should just work. You should just like, stop doing whatever else you're doing. Stop playing video games, and then everything will be magically fine. It's like it's not that simple.
Welcome back to the How Are You Really podcast. Today's episode is Lost in the Pressure Cooker, a South Asian ADHD journey. My guest today is Dr. Sulman Aziz Mirza, a triple board certified psychiatrist in adult psychiatry, child and adolescent psychiatry, and addiction medicine. He works with adolescents at Innova Health System in Northern Virginia and runs Loku Psych, his private practice focused on ADHD, autism, and substance use in adults. Dr. Mirza is also a certified mental health provider for the Washington Wizards through the NBA's wellness program. So yes, he made it to the NBA, just not the way he once imagined. You may also know him online as a Kicks Shrink, where he blends sneakers, humor, and real talk about mental health with more than 90,000 followers. His work has been featured in Time, The Washington Post, HuffPost, NBC, and more. And today, he's here to share his personal ADHD story. Welcome, Dr. Mirza. I really appreciate you joining us today.
Thank you, Dr. Milk. Thanks for having me on.
So I'm going to get right into it. We're South Asian, and I kind of hear about like the pressures that you had growing up and how that experience was. And I mean, you're first gen, so how was that for you?
Yeah, it was interesting, so I was kind of start by saying like my parents were immigrants, right? They came over here. My dad came over in like the 60s, 70s from Pakistan. He came following like his brother who was an engineer. So he did the whole engineering thing, and he's doing environmental engineering. And then we got married to my mom in 1980. My mom was doing med school in Pakistan at their medical school in Multan. And then, they got married, and then I came out a couple of years later, over, he brought her over, and then I popped on out over here in Jersey, and then been like mostly a New Yorker my whole life. And then more recently settled down in Virginia. So I think for a lot of kids who are like child of immigrants, there's a lot of pressure among us, and not just like Pakistanis or South Asians in general, but like I think a lot of children of
Mm,
immigrants, because it's the whole idea that like these people have uprooted their lives, left the country, pursued more money, more safety, pursued any kind of things. They've left their whole lives behind, their families behind to start a new life. And their expectation is like, well, our kids are going to repay us back somehow or other, whether that's through being higher achieving than us, at least minimally as achieving as we
mhm,
are as people, or else just, or else they're not like worth having almost. It was almost kind of like a very black and white, kind of mentality of how kids are seen as like, you have to do better than us, or else just forget it. Just don't even do
mhm,
anything, and, you know, just collect welfare essentially. Not to say there's anything against collecting welfare, but like, that was the mentality, was like all or none. So, I've been pretty open about like my journey in a way. It was like the eldest son, and then my sister, a couple of years younger than I am, and she is significantly smarter than I am. We sometimes will pull out our SAT scores, and she's got me beat all throughout everything. Um, stacking us up from that point of view. But so there was like an internal competition between us. We were kind of like almost pitted against each other in a way, even though I was a couple of years ahead of her, of still being like, well, why aren't you smart like her? Why aren't you working like her? And we both, I think, had natural smarts. And I was, smart enough to get through a lot of schooling without much issues. You know, the when I was going through high school, there was almost like an expectation, like you're going to become a doctor, and this is the only potential field for you. My mom was a doctor; she's a family physician. My dad's an engineer. A couple of my older cousins are in the medical field as well, very high achieving people. But the idea was like, this is your only real opportunity for a job, and this is the only thing you could potentially do. So that was there. And, when I applied, like a lot of kids, from our background is like when you're applying in high school for like these accelerated med programs, these like 8-year programs or 7-year accelerated med programs, I didn't get into any of them. I think I got an interview only at like the schools that were local to me, and they're kind of like, what are you really doing here? So there was like that slap in the face, despite the fact that they all accepted me for like their undergrad, but they were just kind of like, yeah, you don't want to be in this program? No, hell no. So that's what kind of happened. So I had that initial wave of rejections, and my dad's like, okay, well, you're just, good luck. And so I went to like undergrad, started off there, and then like, a couple of years into it, my sister applied and she got into like a bunch of these 7-year programs at the same school that I was going to near our home. Of course, my parents wanted me to live close to their house. So college was the closest house, or college was the closest educational place that in my entirety, it was 5 minutes away from our home. So there was like that. Um, I got into like an accelerated dental program because I was like, I'm going to rebel. I'm going to not be a doctor and I'm going to be a dentist. So I got into like not a guaranteed admission dental program. So I finished my undergrad, went into like a school in upstate New York, failed out of there, right? Because I didn't do so great. And then it was like back home, and it was again my dad being like, well, you're a failure. So you're, what are you going to do with your life? And um, that's when I had like the opportunity to go to like a Caribbean medical school and get a second chance. And from that experience, it was very much like I've seen what happens when you screw up, when you literally fill out of like professional schools and have to figure out what you're going to do with your life. And that's what kind of motivated me to do the next things and be to the point where I'm at today.
Yeah, I was gonna ask you because, like, it's always like doctor, engineer, or you're basically nothing. You're a
Yeah.
disgrace. So, that sounds like that's like pretty typical of our families.
Yeah.
So tell me, like, in dental school, like, where were you at, like, mentally, emotionally when all of this was going on? And
So I was in Buffalo, SUNY Buffalo, like one of the worst cities in America. Sorry, people, anybody who may be listening from Buffalo. Great food, but like, it was cold and gray. Like literally the school had underground tunnels that were built so that people could walk between parts of campuses, and not have to be outside in the weather, just to get an idea of like how gray and disgusting and nasty it is over there. So like the whole underground tunnel system of SUNY Buffalo was like this wild thing that people don't even realize. So that's what it was kind of like. I was living. It was the first time I really had like left home. So I was like on my own. I had gotten like money from like student loans into my bank account. It was the first time I was getting like really money in my bank account. I was like, "Oh, this is awesome. I have money. I can like buy stupid shit." So that's what I did, right? I bought stupid stuff, wasted money, got into like money kind of problems with that. I didn't have anybody on my head to kind of like tell me that I should be studying. I didn't really have great study habits because I was always going to like private school. And this is the thing that like I'm realizing and seeing more in retrospect as like a child adolescent psychiatrist primarily is that when you're in private schools, you don't have the same kind of fail safes per se that a lot of things and people in public school may have in regards to getting things like learning disabilities or learning disorders or ADHD kind of caught. Because you're already in a smaller classrooms, right? You're having this really like really high teacher to student ratios. So, like that grabbing of attention, that individual attention that's really necessary for kids though with ADHD, like wasn't being seen, right? Even like when I was in like from second grade to eighth grade, where I went to like a Catholic school, very small Catholic school. We had like 15 kids in our class, and we just all like from that period on, like we were all together. So there was no way that anybody could get lost, right? Or anybody could get pulled or like fallen behind or drift off or like be inattentive at all, like because you had eyes on you all the time, right? And then even like when high school, a little bigger, our graduating class was 60, again, still tiny, but like, and then classrooms were like, max of like 15, 16, something like that. Again, like you weren't going to slip by. There was always going to have that attention. You were going to get called out, called on if you were dazing off. So I had adapted to that point. And then I have my dad over my shoulder if when I'm coming back home to like do your homework, make sure your homework is done, make sure your homework is done. Mom a little bit more laid back, but still like still involved and very much like, how's everything that's there. But my dad was much more like the kind of the authority, the heavy hand per se behind like the academic part. So when I go to like Buffalo and I have an apartment, I'm like first time alone, I was like, this is amazing. Right. I have all the time that I can do for myself. I can play video games all day if I want to. I can play Xbox. I can just and I'll just study like overnight. I'll just all night do an all-nighter before the exams and I'll be fine because it was fine during college, it was fine during high school, and it managed to do okay. And anybody who's been like in our shoes during our training and as as like a medical or dental student, like you can't pull an all-nighter for like gross anatomy, right? You can't pull an all-nighter for these classes, right? So like, I was scraping by initially. I had to like, then ultimately like I ended up filling out. I missed cut a practice tooth by like a tenth of a millimeter, a little bit off, and they're like, well, that's it, man. You're done. And so that was kind of like a kick in the butt and kind of made me reassess what was happening. So again, like bigger classes, it was lecture halls. That was kind of the differences. I was just like distracted. They gave me a laptop. They gave us laptops to like, do your work on. And I was like, ooh, I can play video games or I can play games on this stuff, or I can like browse the internet while I'm in class. And it's like I can watch whatever it is. So all the things that I was not able to kind of screw up beforehand because of how things were, back in the day in the 1900s where, we weren't being given Chromebooks like these kids are nowadays. Like they're given Chromebooks from like day one. They're told to like, do all the stuff. They're given YouTube and phones and stuff like, so I didn't have all that stuff. So once I had it, then it was like, I saw the results of that and it's, I'm still, financially paying for that today with my student loans almost 20 years later. So,
Yeah. Yeah. So, do you think being from an immigrant family played a role in all of this? Like all of a sudden getting that freedom, or do you think it was just that time?
yeah, I think it was a combination of things just in regards to like, my parents were very much like academics, academics, academics. Like we didn't really play sports. I played soccer in school and then like people when they see me online and then they see me in person, they're like, "Oh my goodness, you're 6'4". And I was like, "Yeah, I'm 6'4". But like I played basketball, but as like a Muslim, it was around that time that like always during basketball season when I was growing up was Ramadan. So
Mm,
for me, I was like, well, I'm a Muslim and I have to fast, and well, I can't practice play for the basketball team while I'm fasting, so I missed out on like basketball season during my youth, I guess you could say. Even though I would play like recreationally and like with buddies and stuff, and during summer like all the time, and I was like decent. But still, like it was like during this school year, I just missed out on that. So that was like a miss. I didn't have like the sports, the athletics, because it was more like, well, that doesn't matter. You're obviously not going to go and become like an NBA player, even though you're tall. Like it doesn't matter. Like you have to become a doctor. So there was that mindset. We didn't do like taekwondo or karate or jujitsu or any of this stuff that a lot of kids do. We didn't do like summer camps. Like I think that we did like a tennis camp for like a couple weeks, during one summer, but like, that was the main thing. It was like, and then even like summer breaks, it was like, here's your algebra book. I still remember like the pink algebra book that I had to go through in like, fifth grade or something like that. That I was like, here's your project for the summer. I wanted to read a lot. So that was like
yeah.
the main thing that we would do just because we didn't have that kind of outlet. So there was that. And then like, it wasn't even, if we're looking at it from like a South Asian point of view as well, like it wasn't even thought of as like a possibility that like this could be potentially going on. But because at the same time, like again, and we see this a lot of time with the kids that I have nowadays, again, is that like grades wise, I was doing fine. I was doing fine. There was no real problems and no teachers weren't getting that feedback. And that it's one of the fallacies that people have about ADHD that parents will often have is that like, well, the grades are fine, so they must be doing fine. And it's still like all the struggle that goes along with the learning processes that's causing issue. And I always kind of think that everybody has some kind of like natural ability that they're able to get through so and so grade without doing a whole lot of work. And I was able to get through, I think, around sophomore year of college without doing much work. And then it started to kind of be like, oh, I have to kind of like actually really do the work and really do projects. And then bit me in the ass when I got into dental school because I was like, I didn't really learn the habits of how to do things.
Yeah. And so, since you're talking about this, like, why do you think for our families, of course, they
Mhm.
don't wanna believe that we have ADHD or anything, no
Yeah.
depression, no anxiety, but what do you think is the reason why? Because we do have so many adults getting diagnosed with ADHD just in general. What is being missed?
I think there's a denial of it. I think there's a denial that like something could be wrong with my child. And then again, it comes back to the whole thing. It's like, well, it's not necessarily wrong. It's just different. Right. And I think we see this with not just things that are, quote unquote, softer diagnoses like ADHD that people will talk about, even though severe ADHD can be extremely debilitating for people, is that we have had historically in the culture, not just South Asian culture, but like American culture as well, but especially I think even more in like South Asian culture, a lot of shame that comes around when there's like, again, quote unquote, something that's wrong or a disorder or a mental illness or a child has like autism or something like that. I have friends who like I didn't know had like siblings because they were like locked away or living somewhere else or, at some point in time, then it comes up, they're like, that I even people that I meet like when I was like 20s or, when I got married and stuff that friends of my wife that like later on, like many years later were like, oh, by the way, I need your help with something. My brother is like autistic. Can you help me out with this? I'm like, you have a brother? Like, what are we talking about here? And this is happening, right? So we shun these people. Like our culture has shunned these people, put them away, put them in corners, not talked about them as much, not celebrated them, not like, acknowledged their existence a lot of times, which again is a terrible tragedy, but it's been happening. So for them to even think that like, oh, something's wrong with this kid, right? Even when when I was struggling in dental school, failing out over there, like it wasn't even like a a kind of like thing that crossed anybody's mind at the time. They're like, you're just being lazy or you're just being, the laziness is a big thing, right? Because people will say like, you're just being lazy. You should just work. You should just like, stop doing whatever else you're doing. Stop playing video games and, then everything will be magically fine. It's like, it's not that simple.
Absolutely. So, in kids, I think when they're hyperactive, then like it's just like, okay, they have ADHD. But in adults, it's not going to be so much hyperactivity. So, what are we looking for?
In adults, more so, we're looking for things like trouble with motivation, right? That is a big thing. Trouble with initiation, task initiation, trouble with follow through. Right. And then classic kind of like ADHD symptoms, like start off going somewhere and then you get halfway to where you need to go to do a task and you're like, why am I here? It just happened to me even like before we jumped on. Um, my medication wore off and, I was walking to record a video for my YouTube channel and I was walking to my office to grab like the iPad from my teleprompter thing. And I'm getting to the front to get to like the iPad and I was like, wait, why am I here again? Right. And I was like, this is why I set out and left my office where I was just to grab the iPad and I get to the iPad. I'm like, what am I doing here? So this kind of stuff that we have on a pretty regular basis. There are other things like I want to say like lack of potential achievement. This is
Hmm.
a major thing that I see with people with young adults, young professionals when they come to me for like the first time that they're suspecting something is up. They'll come through, they'll be like, I'm trying to get promotion at job but I'm getting dinged because I'm not answering emails promptly. I am running late constantly to like meetings and stuff like that. I am disorganized or I have some typos, errors that show up that are causing me not to achieve what I need to do. Or I'm missing meetings, right? Or I've double booked myself, triple booked myself, and I'm forgetting to show up for certain things. So that kind of stuff shows up. Again, it's just the idea that like people aren't able to achieve as much as they in theory could have or should have been doing.
Yeah. So, when were you diagnosed? Like, how did it get diagnosed? What was going on? It sounds like in med school you realized that okay, I need to work harder, but
It wasn't even then. Like, so it was
yeah.
actually after I completed my residency
Hmm.
and my fellowship. So I was out
Wow.
practicing. I'm like what, 30 something years old, mid 30s at that time. And part of this situation was that after I did fellowship, after like a year or something in, I was doing like a lot. So the first year out of fellowship, I was working at the job that I had. I was establishing my private practice. I was still working with a buddy of mine from residency at his clinic every other weekend at his Suboxone clinic. So that was like three jobs. Then I was approached by my hospital system to help cover the adult inpatient unit because their physicians need to study for their boards. So I was like, sure, I'll do it. And meanwhile, I'm studying for my child boards as well, right? So I'm taking all these things on, right? Like four things. I can't say no to anybody. I'm like, sure, I'll do this, do this, do this, do this. And my buddy was getting married. My
Mhm.
buddy, whose Suboxone clinic I was getting married the weekend right before my child boards, right? So you can imagine how that child boards went, right? Because it was just like stretched out like too thin and not being able to like say no to anybody, not having the wherewithal to kind of be like, let me take a week off and like really study for stuff. I was like, sure, I'll just keep doing more things. It'll be no problem. So it was at that time I was to be like, yo, something's wrong here, right? Something is up. Something really needs to go happen, be changing. And then like I'm doing all these evaluations, right, in my private practice. And like at some point in time, I'm doing like an adult ADHD evaluation. And I'm like, what the hell, man? This is my life. I was like, this is what I'm doing. I was like, these are all the things that I'm screwing up in that I'm, again, overextending myself. My bills were late all the time. I was having really disorganized in that when my credit score was like 500, getting out of like fellowship because I couldn't pay this. And I was like, well, I'll just ignore it and then it'll just go away. And it's like, no, it doesn't just go away. Right. My wife's yelling at me because we can't buy a house because my credit score is 500. Right. I still have that going on again. And like, just like a lot of things were just slipping through the cracks that should
Mhm.
not have been slipping through the cracks. And meanwhile, I can't say no to like taking on more activities and more hobbies and stuff. And then even like hobbies, right? I'm getting into like new hobbies for like and fully investing myself into like hobbies for a month at a time. And then next thing you know, I was like, oh, I'm done with this. I was doing like pour paintings. I made like 20, 30 like acrylic pour paintings. And then I like never touched it again for like 7 years after investing all this stuff into it. So these were things that were happening. And so after that, I was like, let me like talk with somebody and they're like, yeah, you have ADHD. And I was
Yeah.
like, oh, and then, got prescribed medication. First day I took it, I was like, whoa, this is what the hell? I was like, what happened here? Where has this been my entire life?
Yeah.
Like, I was like, if this had been caught like 20 years ago, 15 years ago, whatever, like I wouldn't have failed out of dental school. I
Yeah.
can promise you that.
Yeah. Yeah.
Um, all these things would be, my whole life trajectory would have been different. And again, I have no regrets about it. Like I'm much happier than I would be probably now than if I was just drilling and filling as like a general dentist, living in upstate New York, probably still, but in some dying town over there. But I'm very happy to be somewhere else, and with the life that I have right now. But it's that mourning in a way of like what could have been, but at the same time,
Yeah.
like how things could have been different.
Mhm.
And life has been good for me since then. And I've just kind of like, when I started to like look through my life through that lens, it just all made full total sense to me.
Yeah. So I'm an immigrant. So I did my med school in Pakistan and moved here. I have been here on and off throughout my childhood, but I
Yeah.
ended up doing my med school there. So after I moved here, sitting down and studying for boards like USMLE was just the most like difficult thing for me. And I'm so thankful to the psychiatrist who diagnosed me. I mean, in Pakistan, like nobody talks about ADHD. Like ADHD, I had no idea what ADHD is or
Yeah.
anything. And, he diagnosed me with it, and I think the first time I took medication, it was kind of like what you felt. I was just like, "Is this how I'm supposed to feel? Like, was I supposed to feel this way my entire life?"
Yeah.
And so it was such a huge difference and just yeah. So, my experience is very similar to yours, just that I got diagnosed a little bit sooner than you
Yeah.
did. Um, But yeah, I mean, I wonder if I was in med school here and had taken like step 1 after second year and then step 2 in fourth year or whatever, it would have been different. I just had to take everything after getting done with med school, and that was just way too much for me,
Yeah.
sitting down and studying like that. But another question I have is that it sounds like you kind of recognized that when you were taking on too many things, that's when it was like the most difficult for you. My experience is a little bit different, where if I have too many things and I'm multitasking, I can do that just fine. But when I have to sit down and focus, I can't. What do you think is the difference? Like, and why is that? And do you see this in other adults?
Yeah. I think there's still like a lot of trouble with like being able to sit down and do like a singular
Mhm,
thing regardless.
mhm,
The main thing that I would see is more so like a feeling of being not necessarily task paralysis, but like procrastination to the point
mhm.
of waiting to the last minute. And then when you have no alternatives, you're like, I have to sit down and do this. And if I don't do this, then this terrible thing is going to happen for me. So it's almost like, I need that metaphorical like gun to my head to get me to do a task. Like, so I could always do papers, right? And I could always do projects, but I'd wait to the last minute to do everything
Yeah.
and then put myself into these terrible situations where like you're staying awake for like 24 hours to get something done. And that stuff to, eventually it just catches up with you, or it's just too much to be able to do in overnight, especially with things like, again, professional schools and like just the sheer amount of knowledge that you're supposed to have. So that was the biggest. And then like when in med school, I went to like again into the Caribbean, and it was more the fact again that I knew what the alternative was. I had just filled out, right? And I was like, and I'm living on this island. I have like none of my family here. I have nothing else that I'm doing, right? Except
Mhm.
just like studying, going to class and studying, going to the library, and like that's it. The only friends I have are my classmates. We're all studying together to pull each other up from there. So it was more like that was the only potential thing for me to do. So definitely we see it with some people when they're doing like too much, or definitely there's some things where if they're just doing one thing that it's still problematic for them.
So my cousin, my baby cousin, he's not baby anymore, but
Sure.
to me he's still a baby. But my
Yeah.
baby cousin going to med school, he's having a lot of trouble, took MCAT a few times. And I can see that, there's a struggle with ADHD. Talk to my uncle. My aunt's like, "Oh, we're not doing any amphetamines, like, those are drugs."
Yeah.
And then my uncle's like, "No, like, are you sure? Are you sure?" You know? So it was very difficult, but, like, I finally convinced them that he needs to be treated for ADHD. We need to set him up for, success now that he's going to, and he's at Caribbean Medical School right now. But, like, it was just so difficult, such a struggle, um, convincing South Asian parents, like, I'll just say parents, right, that this is a thing. These are not drugs. This is
Yeah.
medicine. Um, do you see a lot of South Asians in your practice? Like, how is that experience? This is an adult cousin now, right? He's in his 20s, so
Yeah. Yeah. We definitely see it. My area where I live, practice in Northern Virginia, we have a lot of South Asians that are here. A lot of people who are like a tech background, because there's, I think it's like 60 to 70% of like America's internet traffic goes through the server farms that are over here, where all of our
mhm.
farms were replaced with server farms essentially. So they call Loudoun County Cloudin in a way, just because
Okay.
of how much of the
Yeah.
server farms are here and how much of internet traffic goes through here. So a lot of like South Asians are here, a lot of like Indian immigrants are here, and then they have their kids. So I see a fair amount of them. Definitely not as much as I think I could,
Yeah.
right? So, but definitely we see my share of them. There is a little bit more push for them to kind of like get some help when they're not academically achieving, or again academically achieving to the quote unquote standards that are expected of them. So this it's a unique area that I'm living in. Like, Loudoun is the richest county in America. Fairfax is the second richest county in America.
Mm.
We're outside of DC. The expectations are really, really, really high in general. And then you add the extra layer of like the South Asian stigma in there, and it becomes like super, super, super high. So when kids are getting like A minuses, right, and parents are like, "What's wrong with you?" Right, and I'm like, "Well, they're doing fine. Like they should be doing okay." Like, it's still something that we keep an eye out for and we look and we evaluate for. But a lot of times we see it when it gets missed for a while,
Yeah.
and then they're seen often like too late, or like they become like adults, and then they're having like substance issues because they've found ways to self-medicate with something else. So nicotine, cannabis, alcohol, etc.
Um, Definitely see a lot of that. I know that you're also board certified in addiction medicine. So, what is your approach with that? Like when somebody does come in with some sort of substance abuse, but you can clearly see that this is ADHD and they're self-medicating, how do you treat that? And
Yeah, the main thing that I do is I treat what the disorder is, right? The main disorder, right? So we've seen studies replicated over and over again, factors that historical data has shown over and over again that like untreated ADHD leads to things like substance use. People with undiagnosed ADHD will start smoking at a younger age, cigarettes and nicotine and all that stuff. They'll also quit much later or have a harder time quitting. We know they're much more prone to use things like nicotine, especially just because there's a stimulant effect that comes with
Mhm.
the nicotine. Alcohol, cannabis, again, those are drugs of choice just because of like access easily, and then especially with more push towards like legalization of cannabis and more kind of like adoption of it, and more kind of
Yeah.
like destigmatization around it,
Yeah.
it's much more readily available. You can go to the gas station now and get some strains of THC at times, which is just like mind-boggling in a way. So that's there. So that happens. We get that a lot of times. And the main thing is that we see is that when we treat what's driving the use, right? And I always ask when I'm doing like an evaluation for a substance use evaluation is like, what are you getting from the substance? What is it doing for you? And people will say things like, oh, it helps me focus, or it makes me calm down, or it makes me less depressed. So it's like, let's treat what that issue is, whether it's medication or whether it's therapy, whether it's a change in environment, whatever needs to get done to kind of make the underlying issue there better, so we can hopefully then remove the desire for some of the substances, especially if they're causing harm. So one of the first things I do is like if I'm having somebody who's like ADHD and substance use and they're not on like a medication for that, like we treat the ADHD
Yeah.
and we use a gold standard thing. Like I will not hesitate using things like
Yeah.
Adderall or Ritalin, etc. Like for people who have substance use issues, because like I know what happens when we do that is like we get the resulting drop in the problematic substance use.
Yeah. What would you advise other South Asian kids and adults? How can they, because even as adults, our parents have a lot of say in our lives.
Yeah.
So, so what do you advise how, when they're noticing even that this is like ADHD and they're kind of able to tell that they're so struggling in undergrad or grad school, what is your advice? How do they bring this up with their parents, or how do they get help? Like, what can they do to like get treatment sooner rather than later?
I think it's advocating for self, like I think you have to speak up and you have to communicate. So if you're like a kid or a teen and you're experiencing any of these struggles, like ask for help from somebody, anybody, like somebody who's a trusted adult. Bring it up, just to have a discussion, to be like, let's take a look and see if this is something that we can evaluate further, with the idea that like, hey, this is going to ultimately hopefully help like our academic achievement and other behavioral stuff,
Mm.
right? So getting, whether it's coming from that angle of saying like, well, you want me to do better in school? You want me to get better grades? Is like, get me a little help, right? Like
Yeah.
I'm struggling with this thing. So really voicing where the struggles are so that people are able to understand that like, hey, let's get some help for this person, whatever that may look like. If you're older, or for parents, for adults and stuff who may be like stuck in the old ways is understanding that like things are different. And we know that like these things have existed forever, but like these are the people that like we hushed away who didn't succeed ultimately, people who really struggled in their lives. And it's like, do you want your kid to be one of those people? Or do you want to give them every opportunity potentially to fulfill what they're able to? And, people will sometimes say, well, these medications, they're like drugs and they're going to make my kid do better. And it's like, not necessarily.
Mhm.
It doesn't make somebody smarter. What it does is it allows them to show off like what they're capable of doing, what their capabilities are, more so than anything else. Is like it unlocks those potentials. Every time like parents are like, well, I know they're so smart, but they're just lazy, or like, I know they can do so much more, but they just don't want to. And it's like, there's a reason for that.
Yeah.
There's a
Yeah.
reason that they're not doing that. And it
Right.
may very well be ADHD or anxiety or depression. And the answer doesn't always have to be medication. People again are always like, well, you just want to put my kids on drugs. It's like, no, I mean, it's easier on me. It makes my life easier to not prescribe anything. Like, do
Yeah.
you think I want to be like sending refills at like 9 at night? Like, no. Last thing I want is like getting messages from people being like, oh, I'm out of my meds. I need a refill. And I was like, that's annoying for me too. Right. I
Yeah.
don't want to do that. It's more liability on my end. Right now I'm working with residents, pediatric residents, and talking about overprescribing a lot. That's like the last thing that you want is like bottles of pills with your name on them, right? Because they could be used for any and all kinds of purposes. I don't want to prescribe anything, right? It makes my life much easier to not prescribe stuff. So we don't want to do that. We want to still develop study habits, study strategies for academic success. The medication can be potentially an option that can help facilitate and make those things better for the
Mhm.
kid, or easier, or able to do whatever is needed for those things.
Yeah. Do you have like certain planners or certain specific things behaviorally that you advise, let's say like older teenagers and adults?
Yeah. I do like a lot of like the basic kind of like planner, reminder, phone stuff. But a lot of times what I tell people to do is do something more manual, more tactile. So something like writing something down, like physically writing something down, not just making a reminder in your phone, because you're not going to open that app. Right.
Mhm.
You put it in your phone and then it's gone. People talk about calendars. I like calendars. I used to have a big like marker board calendar that I would have like in the hallway of my home, and I would update it. But then what would happen is that like end of the month comes around and then you're like, oh, I'll just update it the next day. And then that becomes like a week into the month and then you're falling behind again. So I found this thing online called DAC board. Um,
Okay.
and it's just, I think they have like better versions of it now, but and it was like a fun little project for me to kind of then make. But it was like using like the little nerdy Raspberry Pi small microcomputers, and then you're able to hook it up to a monitor, and it's like a digital calendar organizer thing. And it was able to like sync up with my phone. I was able to get it to
Okay.
sync up with my phone. And then I have that as, displayed again. It took the place of the marker board and displayed in
Yeah.
the hallway of our home.
Yeah.
So I can't, like do anything in the home without passing by this board that is digitally updated and up, it has all the information, that has got like the weather and how long the commute's going to be, and like all the other, it's got a photo
Mhm.
album. So my wife doesn't just yell at me of like, the
Mhm.
family of the kids. So there's like, that's going on as well, like all the stuff that goes on there. And, like I'm not endorsed for them. I should probably reach out to them and have them endorse me or something like that.
Yeah.
Cause but like at this point, like it's been really good because
Mhm.
now I know, okay, it's like if something's happening, put it into the phone and then it's
Yeah.
automatically going to show up there, and I'm going to pass
Yeah.
by it dozens of times per day. So I know what's happening. And then my wife knows what's happening. My kids know what's happening. We put all the stuff there so that you can't miss it. And my kids will always be like, what is this podcast that you're doing? Why is it on the calendar? Like, what's happening? I was like, don't worry about it. It's for me to know. So little things like
Yeah.
that help me to kind of like, I need that visual reminder. And in general, what I tell people is the best probable thing you can do is like have a support person. Right. And, it depends how you want that to be. Like if my wife yelling at me to do stuff is helpful because I get stuff
Yeah.
done. Right. I joke around that she yells at me to like do things or to send put in the bills and all this stuff, but like it works, right?
Yeah.
Now I've learned like automatically if I get like something new and it has to be like an auto pay, like how do I do auto pay immediately so I don't ever forget it, right? So that's been fine. To doing all those things is like by getting into the routine and trying to put things on autopilot as much as possible. Someone yelling at me, something I can visually see all the time. Even my private practice, we have like a messaging system for my
Okay.
patients,
Yeah.
and I hire an assistant to like give me a to-do list at like a couple times a day of like, give me my to-do list,
Yeah.
to forward these messages and tell me what's my to-do list. And that's how things get done, is like by having those layers. Cause I know if I'm like, oh, you want me to check emails? You want me to check messages and like to figure out what needs to be done? Like, it's not going to happen.
Yeah.
So you need to have somebody be like, do this by now.
Yeah. I really hope my husband feels the same way about being yelled at, because I think he's the worst case of adult ADHD I've ever seen. So I hope he appreciates me
Yeah.
reminding him nonstop.
There's tension, but at the same time, I'm like, I understand what this is
Yeah.
for. I can look and be like, I will thank her. I will make my prayers for her and say thank you for all the stuff. But at the same time, I could be like, I'm not appreciating this, but
Yeah. All right. So something fun. The kick string. I'm
Mhm.
curious, your love for sneakers and then the edutainment is how you put it. I really love that word. Does this also kind of like has something to do with your ADHD? Like, how did you end up with this and
Yeah.
just kind of the word, the kick string?
Yeah. So I've always been like a sneaker fan, sports fan. It
Hmm.
was very
Hmm.
like, massive part of my life kind of growing up. But my parents, of course, would not spend money on sneakers for me. Right. So it was always kind of like the delayed gratification of it. So once I started to like, finally got to a point where I could like buy my own clothes and buy my own shoes. I was like, let me start buying these sneakers. And it was really coincided with like the kind of the reemergence of like the sneaker culture
Hmm.
of when everything was like, Jordan was re-releasing all the old sneakers and making updates and all that stuff. So I was like, let me just, this is part of what I want to do. So started buying sneakers again, like as a stupid ADHD thing, right? And like next thing I know, I've got like a wall of my house, like 100+ pairs of sneakers,
Yeah.
um, that are there. And like I'd always show up to work, especially like during COVID, with like just wearing sneakers, different pair of sneakers
Hmm.
every day. So the nickname kind of like came about from there. Like, damn, the shrink is like, he's got awesome kicks, and like I like your shoes, like your shoes, like your sneakers, man, awesome sneakers. So it became like a little like, let me see how to kind of, I don't want to say brand myself, but just kind of like come up with a nickname for that. So the kick shrink was where it came from. We're in the process of like trying to buy a house now. So like we're gone through all like that shoes. I was like, man, this was like, I definitely like blew a lot of money that maybe I shouldn't have
Yeah.
on these sneakers. And I'm going to like end up selling like 30 something pairs of shoes. I have like ready to kind of like get rid of a bunch of them. Um, but it came out of there, and like, I still always like, appreciate that. I still always wear
Yeah.
sneakers to work,
Yeah.
and see what like some of the newest stuff that's there. But that's, where it kind of came from, was all of that. And, it took that persona also to kind of say, at the same time, like it's in a way of representing my approach to mental health and psychiatry and communicating with people in general. Was more like, if I'm a stuffy old white guy wearing, like a tweed blazer and smoking on a pipe and, like talking about your mom, like I'm not able to connect with people, or my message is getting filtered through that. So if I'm able to like connect with my teen patients, right, on some level, and my adult patients on another level, like be a quote unquote normal human being, that's what I'll do, right? And that'll be part of like what my brand per se is that like I'm a normal human being, right? I want, when I was doing TikToks a lot of times, like I was cursing plenty in the TikToks, and, just to be like, yeah, like we can do this stuff as well. Like we can be normal human beings and discuss this stuff. And like part of it also was like, and I'm sure you see this like clinically as well. Patients will like sometimes they'll curse and they'll be like, "Oh my God, I'm so sorry. I feel
Yeah.
so bad for swearing." And I'm like, please, like say fucking shit.
Hmm.
Because like, like I want you to express what you need to say. And if that's the language, the words that you're going to say, sorry if I swore, but like if that's the
You're
language
fine.
that you're gonna like say to express what you feel, like please do it more. Don't feel like you have to censor yourself because of me, because you think that I'm like this person who doesn't do those things or will be offended
Yeah.
by hearing these things.
We want them to express like their deepest feelings, right? And a lot
Yeah.
of times those come out as cuss words.
Yeah.
That's where it is. Okay. So we talked about the sneakers. I wanted to talk about something else. I'm forgetting. Oh, yes. So kids. You have kids. Are you seeing any ADHD symptoms in them? What do you think like the chances are of like kids developing ADHD when parents have it?
Yeah, we know that there is a very strong
Mm-hmm.
genetic predisposition for it. I
Mm-hmm.
definitely see some stuff with my two eldest ones. There's like some small stuff that's showing up. My oldest one right now is the boy, and he's got some stuff. I'm kind of like, is this something we need to be kind of looking out for or more attention to? He's been a similar-ish kind of path with me, as in like my wife has decided they're going to private schools, to like Islamic schools. So
Mm-hmm.
small classes, small classroom sizes, the private school setting. And, he's done fine and done well over there, but definitely like, I'm kind of like, are we covering this up? Are we repeating some of the same stuff by not having them being in like a larger setting, and then like potentially some of these things can emerge,
Yeah.
or will it emerge too late when the plan is to transition them to like high school and public school, and that setting? There's some stuff at home that I'm like, what's going on here? Why are we not doing the things that we're told to do? Right? That makes me be like, is this just kind of
Mm-hmm.
manifestation of like an ADHD in some way? So it's there. I mean, there's things that I definitely am keeping my eye out for. And I won't hesitate, if we get to a point where we're like, hey, we're struggling, what's happening? There's these people online and people in general who will say things like ADHD is a superpower, or ADHD is not a problem, you don't need to do anything, blah, blah, blah. And it's like, it can be, depending on what the situation is, depending on what our goals are, what we want to have happen. So, if he's going to grow up and he's going to become like a Fortnite streamer on YouTube or something like that, then like, great. ADHD is a superpower for him, right? And it can be fantastic. It can really help him be an engaging personality on like something like YouTube, and he can do some fun stuff and blah, blah, blah. And it can do really well for him. But if he wants to go work in like a cubicle when he's older, and work like a 9 to 5 and have these very rigid kind of expectations, like
Mm-hmm.
he'll probably struggle, right? Like
Mm-hmm.
he'll have some struggles. And like, if there is something with ADHD there, then
Mm-hmm.
like it's going to be really hard for him. So
Yeah.
it's something where like we, keep an eye, lay back, let it play out. And like when it becomes a problem, it becomes a problem.
Yeah. Okay. One more thing. NBA. So you are a certified psychiatrist, physician for them. What are you seeing with basketball players, like ADHD, or is there other stuff? Like, what are you seeing?
A lot of kind of like anxiety. We see a lot of anxiety, expectations that come along with the job, with the profession,
Mm-hmm.
ideas of like self-worth, like how, social media is perceiving people,
Mm-hmm.
fan bases are perceiving people and athletes, how they're a commodity versus like a human being. So there's that shows up a lot of times. Substance stuff, that shows up. That is a possibility, like that does show up, especially when we have things like injuries.
Mm-hmm. Yeah.
I mean, like injuries in sports are huge, right?
Yeah.
Like because they can be potentially career ending for people, or performance enhance, or performance
Mm-hmm.
destroying, performance affecting,
Mm-hmm.
which then leads into all kinds of problems with like their ability to earn money and stuff,
Yeah, absolutely.
right? Which is, and provide for their family or whatever expectations or whatever they need to be doing as well. So people talk a lot about how like money is or lack of money is the root of problems for a lot of like mental illness or problems. And nobody would be depressed if everybody just had money, or nobody would have, anxiety if they just had money. It's like, no,
Mm-mm.
because there's professional athletes who are making tens of millions of dollars, hundreds of millions of dollars, who have these same issues, right? We know trauma is still a thing. We know a lot of these people, a lot of these athletes came from like really traumatic backgrounds or childhoods. Parents may or may not be there, or there may have been crime, etc. that was there. They may have had their own experiences in the legal system as a whole. So it's something where it's like they're coming through and that they may be still dealing with those same issues.
Uh, what do you feel about like sports and just active, like maybe like somebody's an ER physician or a firefighter, EMS? Do you feel like that helps somebody with ADHD? What do you see in your practice, like with like, professions that are kind of busy and like keeping them more active?
Yeah, I definitely, I'm a huge proponent of like exercise and physical activity to help manage not just ADHD, but all kinds of things in physical and
Yeah.
mental health, right? All parts of
Yeah.
psychiatry, like exercise is a huge part of it. And again, like we hear from people online or other people who are just like, oh, doctors just want to prescribe a pill. They don't prescribe exercise. It's like we prescribe exercise every time.
Mhm.
The patients just don't do it. Nobody does it, right? Or the patients or like in cases of like depression, like they're not able to, like they're so depressed, they're not able to do things like exercise.
Yeah.
Like I always tell people is like eat better and sleep better and, exercise and like you'll feel a lot better. And I'm always reminded of like there's like the video memes or the reels that you'll see of the people who are like, I'm going on my stupid mental health, or my stupid walk for my stupid mental health. And like, I'm mad now that I'm feeling better because now it works and now I have to do this again. And it's
Mhm.
like, yeah, it works. It helps, but
Mhm.
you've got to be in a
Yeah.
position to be able to do it in the first place. With ADHD, like we see this a lot with like young kids, especially parents will say things like, the busier they are, the more active they are, the more they're like doing sports or after school stuff or camps where they do activities and are outside, like running around, like they do better.
Mhm.
Um, and then like when a season ends and it's their off season or it's like winter time and then they're like things get worse during that time. And it's like, yeah, because we manage that for the most part, manage the hyperactivity, manage the energy by doing the sports.
Yeah. Do you think it helps in adults too? Like, I mean, as
Yeah.
far as like ADHD aspect is concerned of that, would
Yeah.
that
I think it does. I mean, like, I,
yeah.
I definitely think so that, like, again, we don't have the classical kind of like childhood hyperactivity that we see in
Mm.
adults, or that we see in children in
Mhm.
adults. But we definitely see like there is still like an aspect of energy that needs to be released and can get out. I think people have talked about this over and over again that like they're physically just like perform better or they mentally can perform better once they're more active. They may need less medication or um, they just may need to not to use it as much by being more active. I think or it's just a way for them to kind of like and get that energy out, that distractibility out is through things like exercise.
Yeah. Okay, so one thing that you would hope that most people or you wish that most people knew about themselves and a way your story can help them.
I wish that people knew that like they don't know everything about themselves. I think and that like what they've been told, what they've heard their whole lives may not always be the most accurate.
Mhm.
So I would encourage them, like if they're feeling something is off, something doesn't feel right, something needs to be improved,
Mhm.
is to like ask for help. Right. And I say this a lot to like my patients in general is I struggled with like asking for help when I
Yeah.
was younger. And I was like going through the academic system. I was like, I could just do it on my own. I could do it on my own. It's not a problem. And that you get to a point where you are not going to be able to do it on your own. I mean, that's what the education system is set up to be, is that you have to learn from people that know more than you do. Right. And that's how we learn. And until like I was able to like fully grasp that concept, like I struggled or I fought it or whatever it was, that was a huge thing. So being able to ask for help in anything, right? Whatever area that you're struggling in, and just the awareness that like there are people who know more than you and that is fine and that is their role. And if they're like a decent human being, like they can help you out. And that is just humanity as a whole, is that we should be able to help each other up and bring each other up versus like, hoarding all this information or not sharing with other people. Like part of the reason I take on or I work with like the pediatric residency
Mhm.
is for this reason, to be like, let's share this knowledge. As we get a pediatric residency in the coming year, you know, or a psychiatric residency in the coming year, like I'll keep working with the Pete's guys too, just because I think we don't need to just safeguard or just kind of like be protective about this information that's out there.
Like
So
primary
yeah,
care, right?
yeah,
They need to know. Yeah.
need to know this stuff. So I think just being able to ask for help, not being too proud to ask for help, not being too ashamed to ask for help, like is massive. And that's what's going to really just again unlock those possibilities for people.
Yeah. How has your own diagnosis of ADHD helped you be better at psychiatry, just a better psychiatrist overall?
I think it's more empathy per se, just being able to understand some of the struggles that people are going through. To understand that like this can affect anybody and everybody. That it's not just like for the homeless people that you saw on the streets during our residency and training that were coming into the ER in the middle of the night. That like no, it can affect people of all socioeconomic status. It's an equal opportunity kind of thing that's there. So that's, I think, important to kind of keep in mind for myself. I think I can see and hear stories that are similar to kind of what I've gone through and be like, yeah, I have an idea of where you're coming from.
Mhm. Yeah.
But at the same time, being able to like separate that, what because it happened to me, it doesn't mean that this person is the same thing as me,
Mhm.
right?
Mhm.
So being able
Yeah.
to keep those boundaries in place.
Right. Absolutely. I have to always ask, and I want to always know, how are you really doing?
Doing okay right now, right? I think the big thing is like, I'm a simple person in a way that like I try to, people will, when I'm working in like with the residents and we have like a tough case and like you hear the horrific stuff that goes on in people's lives and or experiences they may have had, whether it's trauma, other stuff like that. They're like, oh God, how do you do this every day? And the way that I look at it is like I try to feel, or I feel like I've done more good in the world, that I've put more good out in the world on a daily basis than negative stuff that I'm putting out there. And if I do that, then I can sleep easy at night. Right. And do I enjoy what I'm doing? Do I like what I'm doing? Yeah, I like it. I like enjoy working with my patients. I like working with the people that I work with. So I get up every morning and I'm like, let's do this thing.
Mhm.
So I generally feel pretty content in that regards. A wonderful wife, got 4 kids who like drive me like ridiculous, but I love them very much. So that's, keeps me happy. We're in the process of like potentially like, trying to get a house right now, which is like its own kind of headache, but we'll get
Mhm.
through there. And, that'll be, when that's, hopefully done, that'll be like one of those like checkbox moments, like,
Mhm.
I can exhale and like last things to kind of do or achieve in my life that I'll feel like, all right, I've done everything now that there's something here that I could, that's
Yeah.
mine per se. Right.
Absolutely. Thank you so much for coming and sharing your story and all of the wonderful insights.
Yeah. Of course. Thank you for having me.
Before we close, I always ask, how are you really doing? Thank you so much for spending this time with us on How Are You Really? If something in this episode spoke to you, send it to a friend, leave a review, or follow the show. It really helps. Until next time.